Hello everyone, once again welcome to my Oet channel. Today we will have another one Oet roleplay discussion. The setting is pediatric ward and you are talking to a parent of 10 years old boy who has undergone tonsillectomy. And this is nothing but discharge discussion. So we will see the setting, it is pediatric ward. And the task, before going to task, the scenario is a 10-year-old boy has had a tonsillectomy and is due for discharge the day after surgery, and we are talking to patient's mother. His mother thinks Mike should stay longer, as she says he is still in severe pain and does not appear to be very alert. Mike has a fever and looks unwell. He is having difficulty taking fluids and he is on Tylenol for the pain. His recovery is expected to take between 10 and 20 days. The parent appears anxious about the child's condition. So this is the scenario, overall scenario. So here you have to underline tonsillectomy and the boy's name has given already Mike, so no need to ask to the interlocutor. And now he's getting discharged, but mother is thinking that he needs some more hospitalization. And still patient has severe pain and fever. Moreover, there is difficulty for taking fluids also. But he is on medications for pain and the recovery will be expected within 10 to 20 days. Okay, so this is the overall scenario. Now we are going to talk with the patient's mother. And the task is, first one, confirm the son's readiness for discharge. No complication, find out parents' concern, example pain management, self-care after discharge. So you are going to see the parent and with the parent. So what you have to do, you have to ask mother's name during treatment preparation time. No need baby's name because they have given that it's Mike. So you will just ask that name and you have to write parent name in bigger letters and baby's name in small letter in your card. It will be easy for you to present during the conversation. And how we can start? We can start like this. An example, mother's name is Maria. So how we can start a conversation? Good morning, Maria. How are you? And how is your baby doing? So this is the casual talk. Then the answer will be, good morning sister, I am fine, and Mike also, it's okay. And then our task is we are going to introduce regarding the readiness for discharge. Then we can tell that, Miss Maria, actually I came here with the good news that your son is getting discharged today. Are you aware about that? And do you have any concern regarding his pain management or any self-care after discharge to home? Then the answer will be, I'm really somewhat worried about his condition, sister, because still he has a fever and severe pain, and I'm thinking that still he needs some more hospitalization. Then our next task is confirm hospital stay not necessary. Example, standard procedure, satisfactory recovery. Reassure the patient about some symptoms, normal pain medication, persist 1 or 2 weeks, intense pain, seek medical help. So what we are going to tell is, first one should be a reassurance. So we can tell that, Miss Maria, I can truly understand your concern being a mother, how you are feeling in this moment. But no need to worry about your baby's condition because he has undergone a standard procedure and he has a satisfactory recovery as per his doctor's note. And I can reassure you that your baby's symptoms like pain and difficulty to swallow and everything, it is very quite normal after tonsillectomy surgery, because it will take 1 or 2 weeks to get complete relief from all these symptoms. And one more thing I would like to tell you, that if your baby have intense pain, you can seek medical attention for him at the hospital whenever it is required. Other than that, no need any medical attention, because upon discharge we will give you pain medication for your baby. How does that sound? Like that we can ask with reassurance. You have to explain everything to mother. Then the next task will be explain after effects of tonsillectomy, like pain over ear, neck or jaw, nausea and vomiting, mild fever, bad breath, swelling of the tongue or throat. Convey other difficulties child may suffer, like feel something stuck in throat, anxiety or sleep disturbances. So the mother's answer will be, okay, it's fine sister, I can understand. So could you please tell me, maybe the question will be, could you please tell me the after effects of the surgery? Or else maybe mother will tell that, okay, it's fine, I can understand. Then we can tell that And Miss Maria, I would like to tell you that longer hospitalization is also, it's not mandatory for babies after hospitalization, because after tonsillectomy, I can tell you that the some of the normal after effects are pain over ears, neck, jaw. Sometimes babies may experience nausea and vomiting, mild fever, bad breath, and swelling of the tongue or throat. In addition, there will be some other side effects, some other after effects, such as feeling something stuck in the throat, anxiety, or sleep disturbances. These everything are very common among patients, those who are undergoing the surgery. So are you getting my point? So for your baby also, I mean for Mike also, these all symptoms are very normal one, and within 1 or 2 weeks, I can reassure you that it will fade out normally without any management. Is it okay with you? Like that we can ask. The next task is explain post-discharge care. After discharge, after getting discharged, what will the care? Like medication directed by surgeon, fluids, plenty of fluids, avoid dehydration, consider water and ice pops, rest, bed rest in initial days, no strenuous activities for 2 weeks. Then we can ask, Miss Maria, do we have any more concern regarding Mike's management at home? Then maybe a mother is asking that, sister, really, I'm thinking about the care after discharge because I'm not sure about what are the things I have to take care. Then we can tell that, no need to worry, Miss Maria. I will explain you the post-discharge care. The first thing will be medication. Please follow all doctors' instructions for medications. Regarding fluid, please provide him plenty of fluids to avoid dehydration. Consider water and ice pops also because he has undergone tonsillectomy. Regarding rest, please provide him adequate bed rest for initial days, and please try to avoid strenuous activities for him for 2 weeks. So these are the post-care, post-discharge management. So are you getting my point, or is it clear for you? Like that we can ask. And then one thing you can ask your patient, do you have any concern? The another topic you can explain yourself, like advised dietary regimen. You can tell yourself. And now I would like to give you some more information regarding his dietary regimen. May I? Like that we can ask, may I explain you? Then after getting permission, you can continue. Here everything, it should be like a polite manner. You should not use any demanding words like you need, he has to, he need to, like that. So it's in simple way you can present like this. It is very essential for him to have food which is easy to chew, swallow, such as ice cream and pudding, if tolerated. Please try to avoid acidic, spicy, hard, and crunchy foods. So these are the things. Please take care for his dietary regimen. Are you following me? Like that we can ask. Then we can ask, do you have any more concern to clarify? Then the mother's question may be regarding the socialization. Could you please tell me whether I can send him school after the next day of discharge? Then we can tell that, I can truly understand your concern, Miss Maria, but I'm really sorry to tell you that the thing is, we are providing a time scale for socialization. So we can tell that, I'm really sorry to inform you regarding the socialization. It is advisable to avoid visitors and people with a cough and cold, because if he returned to school, maybe there is a chance to get infection. So please try to give him adequate rest, at least minimum 1 or 2 weeks from school, so he can take rest at home. How does that sound? Like that we can ask. Then we can ask another one more thing, when she will resume to normal diet, and when he will return to normal diet, and when his sleeping pattern will be normalized without any disturbances. Moreover, when he will be out of pain medication, you can send him school. So is it okay for you? Like that we can ask. And the last task is when to see the doctor. So you can ask, do you have any more concerns? Then maybe the parents' question will be, yeah, my last question will be, this is the one, when I have to get him back to the school, back to the hospital for follow-up. Then we can tell that actually no need for any appointment or any follow-up visit for him, because it is advisable for him to get to the emergency department only if he has any bleeding, fever, signs of dehydration, or any breathing difficulty. If nothing is there, no need for any follow-up care. You can continue the stay, and once if he will resume all normal parameters, you can send him school. So that is the all instructions. Then how we can conclude? Then we can ask that, Miss Maria, I hope I have clarified all your doubts. Do you have any more concerns or any more questions? Then if there is no, means we can just conclude. If you don't have any questions, may I proceed with his discharge procedure? So that is the conclusion, because we came here to discuss regarding discharge procedure. And if you have time, you can sum up, but here of course you will not get the time. But if you get time, you can just sum up. For now we have discussed regarding his dietary management, medications, rest, and visitor restrictions, evacuations, everything. So I hope everything is clear. If you follow all these measures, of course Mike will get well soon. So like that we can sum up. Then if you don't have any other questions, may I proceed with his discharge process? So that is the end of the role play. So like this you can sum up. Such type of discharge discussion is a very common question among all OET exam. In that, if you are talking directly to patient, it will be easy, but if you are talking to parent, means it will be a somewhat difficult task, because always you have to use the word, it is essential, it is beneficial, it is advisable, please try to avoid for him, her, like that. You have to be conscious, because when you are explaining, it should not be towards the parent, it should be belongs to the patient. So that is the thing, you have to keep it in your mind. I hope it is clear for you. We will see with another one role play discussion. Until then, bye, take care.